It's hard to believe, but new survey results from the Seattle Indian Health Board found that one of nearly 150 Native American women interviewed, nearly all reported being raped or coerced into sex. To help give us insight on these troubling statistics are Abigail and Esther Lucero, both from the Seattle Indian Health Board. I read this article in the Seattle Times, and I had to reread it a couple times because I was in disbelief of this number. Obviously, it's terrible for this to happen to anybody, but why is the number so high amongst the Native American population?
So we know that our population is very vulnerable as a result of how we ended up in this city. We have Native people who this is their original homelands, and we have other people who were taken here by the federal government during relocation programs, and our people also come for other economic reasons. As a result of those, what we found is that for many of our people, the services that they needed, the culturally competent care, the understanding that they needed as Native people wasn't there, and so we have large rates of people who are both living homeless on the streets, which you actually saw in this report. A majority of the women that we talked to were homeless or very low income, and so it is a very vulnerable population within our own larger American Indian Alaska Native community. And so some of those structural things that have happened to our people have directly resulted in this.
Yeah. And I know that there is a stigma against going to police culturally, that there's not a lot of trust in police. So does that mean that these generally go unreported?
Yes, definitely. There's a mistrust of institutionalized systems just generally. And I think that with the John T. Williams shooting, I mean, that kind of further perpetuated, distrust for police systems. And the fact that only 8% of those that were reported were actually convicted, right, or resulted in conviction. I mean, so that's pretty significant.
So what are you doing right now as the board? What is your role in all this? Are you trying to get services? Are you trying to, connect them with police? Is it too late to report these incidents? I mean, there's probably a million things that you need to do.
So there are several different things, and I think that Esther and I can both speak to them a little more individually. So I direct the Urban Indian Health Institute, which is a division of the Seattle Indian Health Board, which does the data and the research. So my work right now is looking at how do we gather more information? What do we do with this information? How do we ensure that it's actually reaching the community that it needs to? And it's recognizing that for our county departments, for our city departments, we in our community have known that there were high rates of sexual violence. 94% was more than we thought, but we already knew that there was problems. However, we never had the data to go to the city, to go to the county and say this is what's happening. And we also want them to come to us. They also need to recognize this is happening. We now have the data and they need to come to us.
And from a service delivery perspective, I think it's important that we listen to our community and we implement culturally relevant programs to actually support our people. So for example, having sexual assault nursing examiner contracts with community health centers, not just the hospital systems, could be one example where we could actually employ some of our community advocates to support women when they actually have to receive that type of service, right? It helps build trust and it helps create the community response.
And are you doing anything just kind of to reaching out to Native American women in general, or trying to get to these homeless populations to kind of give them resources, tell them where to go, what to do if this happens? Is there counseling available?
Absolutely. So one of the things we did before we released this report publicly was to do it with our community first. And so we had a community release. It had all of the major Native organizations. So we are partnering with the other Native organizations here in the city, the Chief Seattle Club, Mother Nation, United Indians of all tribes, and others, to ensure that we can provide as much coordinated service delivery as possible.
So going back kind of to the original question, is it the fact that are homeless women in general more vulnerable to sexual assault? Is it because there's such a large portion of Native Americans who are homeless that number is so big?
So we did find, that the women who participated in this study were, half of them were homeless. However, there are others in the study who were not. And so when you look at the national statistics, we actually find that Native women are much more likely to be raped in their lifetime, to be sexually assaulted, to be victims of physical violence, domestic violence. We see it as a national problem, not just in Seattle. The data we have is just for Seattle.
So I think homelessness is a component of it. However, I do think that this can go back to our experiences with the boarding school, which is where we started to see our family systems be dismantled, removal from cultural practices, from communities that were warm and nurturing and supportive. And so I think when you see those systems break down and you move generations forward, we're looking at communities that have are just seeking that knowledge, to return, to make sure that we can live healthy lives. That, coupled with the fact that dehumanization is part of just colonization and genocide. And so I think that many folks have a really hard time seeing American Indians, Alaska Natives as human. And so what we do see is we see violence that's coming from both outside of our communities and within our communities, one from broken systems and one from dehumanization.
Yeah, that's what I was wondering. I mean, are they being targeted because of their race and their nationality, or is it because of, the jobs and the places that they are because of their socioeconomic status?
I think it's a combination of both. And when we look at the mistrust in the police, when we think about predators are very good at grooming. Predators are very good at finding those the most vulnerable.
Yeah.
And when they find the most vulnerable group, they're more likely to be continued to stay in that group and to continue to victimize. And so we have to look at that mistrust that exists within the policing system. So if our people are not reporting, so in the report, only 20% of the women actually reported that to the police, and out of that 20%, only 8% saw a conviction.
Yeah.
Why is that? That's my question to the justice system. That's my question to SPD, because that's where a problem lies. And so for that very small portion, it kind of didn't even matter that they reported it. And so we have to look at what and why do those systems not help our women.
So is there any programming that you're doing for young women to kind of start early and to get them on the right track and to let them know what they should do or kind of how to avoid these situations if possible?
So I don't like to place the onus on the women to avoid being raped.
No, I agree.
What we have to do is really place it on the community and say, why are women being raped? It's not the women's responsibility. And so I don't want to teach our girls to what to do when they've been raped. I don't want them to ever be raped. And so what we want to do is to look at what's going on in our communities, incredible programs that Naha'ili Fund and others are doing to support our young women. But we also have to look at the society and say, why are Native women being victimized at this rate? It's not the Native women's fault.
Thank you so much. I hope that people are listening and learning and that this will make an impact. Thank you so much. We'll be back after this.